This is a review of the lungs. Here we have the right lung, and here we have the left lung. Between them is the heart and the mediastinum. We could see that the right lung is a little bit more chubby, as to say, than the left lung, a little bit more shorter, wider than the left. Starting with the right lung. As you all know, the right lung has 3 lobes and 2 fissures. The oblique fissure over here and the horizontal fissure. Also, the right lung has an anterior border as well as a posterior one. It has a base over here and a costal surface and a mediastinal surface. This is the upper lobe over here. This is the middle lobe, and this is the lower lobe over here. Starting with the mediastinal surface, most obvious is the root of the lung, surrounded by its hilum. Also, we could see some depressions on the mediastinal surface. Starting with the root, there is the main right bronchus with its hip arterial branch and the hip arterial branch. Right here is the pulmonary artery anterior to the bronchus, a little bit more firm and elastic than the pulmonary vein. Over here is the superior pulmonary vein on the right side, anterior to both the bronchus and the artery. Over here is the inferior pulmonary veins. Of course, they're gonna join each other before entering the left atrium. Okay, now we're gonna move on to the depressions. Of course, the esophagus is posterior to the trachea, as the like these 2 fingers right here. Over here is the esophagus, and right here is the trachea. So the esophagus will depress the apex of the right lung a little bit posterior to the trachea, and the trachea will be, of course, anterior to that. Now, this arch over here, this depression, is from the azygous arch, which is the vein going from the inferior vena cava to the superior one. Over here, if you could imagine the azygous arch adjoining the superior vena cava before entering the right atrium, which has an impression right over here, which is supposed to be covered with the parietal pleura. Of course, when I say the right atrium, I mean the fibrous pericardium of the right atrium. And the inferior vena cava, when it enters the thorax from the abdomen just for 2 centimeters of length, it depresses or impresses the right lung over here before entering the right atrium.